Welcome to episode 12 of Insight Weekly, your security overview from the past 7 days across the globe. If you enjoy our weekly podcast, please subscribe to our YouTube channel where you can be the first to watch new episodes every week. Please feel free to like and share the video, drop us a comment, ask the analysts any questions, and let us know what your key takeaways are from this episode. This week, we will be completely focusing on coronavirus, initially beginning with an overview and then a summary from each of the analysts on the pandemic so far, before we have a roundtable discussion regarding how the analysts feel things may develop globally. Yesterday, the World Health Organization officially declared COVID-19 as a pandemic. Michael, would you like to take us through the key points of the outbreak?
Yes, so coronavirus, it's a new respiratory disease which was first detected in China, in Wuhan, and it's now affected over 100 countries. Out of the top 10 most affected countries, 3 of which are in Asia, 5 are in Europe. And if we use the World Health Organization phases of a pandemic alert, and this is for H1N1, but it'll work as a basis for coronavirus. So the first 3 phases are predominantly animal infections with few human infections. Phase 4 is sustained human-to-human transmission, and then phases 5 and 6 are the actual pandemic itself. And as you mentioned before, the pandemic was labeled a pandemic yesterday. And then after this, we move on to post-peak and then post-pandemic. But it's worth highlighting that, we are still at the very beginning of the pandemic. And if we make comparisons to SARS, which I believe is from the same family as coronavirus, which that outbreak was in 2003. Now that affected 8,098 cases, of which 10% of the people who were infected actually died. Now, the economic impact of that was $40 billion. With coronavirus already, it's impacted 128,000 confirmed cases with over 4,800 deaths. So it's already, a multiple of 5 times worse than what SARS was. Now, the economist who actually calculated the economic impact of SARS, he also made a calculation as to the economic impact of coronavirus in January 2020, and he was suggesting that it could actually be 3 to 4 times the financial economic impact of SARS. Now, that was in January. We're now into March, and it looks like it's actually worse than it was it is worse than it was in January. So in my assessment, it's actually the economic impact is probably going to be far worse. Also, experts are stating that in comparisons to the yearly influenza virus, coronavirus is probably going to have an impact of 10 to 15 times worse, and we could see up to 480,000 people die as a result of the coronavirus over the next 3 to 7 months. And just kind of focusing on the actual mortality rate. So the World Health Organization had mentioned 2% in both press conferences in January and February. However, globally, that rate is now about 3.4%.
So regionally, Vincent, what have you seen in the Americas so far?
Yeah, so the situation in the Americas started ramping up a few weeks ago with the initial case, at least in Latin America, in Sao Paulo, Brazil. And now it's spread to the majority of South America, Central America, and North America. The numbers are still relatively low when you compare it to what we are currently seeing in Asia or Europe. But those numbers are likely going to increase as time goes on and as testing increases as well. And there was talks of delays in testing in the U.S. due to the CDC wanting to create their own test, but then the initial results weren't what they were expecting, or it wasn't working, so then they had to switch their methods. And so once testing increases, the number of cases that we see, at least in the U.S., will ramp up as well. And we'll likely see that as well as South America and Central America. Some countries haven't yet reported any cases, so you have Uruguay, Guatemala, Nicaragua, Suriname, to name just a few. But due to how population movement and things of that nature, it's likely that they'll see cases as well. What we've seen from in terms of impact, so it's already kind of impacted certain sectors. Initially, the airline industry, so there was the LATAM airline in South America, which suspended flights initially from Sao Paulo to Milan due to the initial case having had traveled to Italy and then come back to Brazil. In Chile, the initial cases were a couple that had traveled for a month in Southeast Asia and then come back. So that the airline sector has been affected, and I think that's globally. Tourism industry as well has been and will likely continue to be significantly impacted. And we've seen cases where Italian tourists who had been tested arrived in Colombia and asked to not be stigmatized for being Italian due to the outbreak in Italy. We've also had cases where a bus full of tourists in Martinique was vandalized just because of the impacts of recent cruise ships having outbreaks. So I think when you, in that case, I think there could be a significant impact for Caribbean countries who rely heavily on the cruise ship industry. So if that gets impacted any further, those countries will take significant economic impacts. As a whole, and just recently, Trump declared a 30-day ban on travel from European countries to the United States. And right after, the Pentagon itself increased that ban for their employees, civilian employees, military personnel, and their family members to a 60-day ban for any travel to, from, and through level 2 and level 3 countries, so primarily Iran, China, Japan, South Korea, Italy. So that's one travel ban, and we're likely to see more and maybe even more localized travel bans or restrictions, as we've seen in New Rochelle in the state of New York. But yeah, all that leads to concerns.
Yeah, so as these numbers do increase, what are your biggest concerns across the Americas?
So I think in terms of concerns, I see one of my biggest is whether local healthcare systems can, especially in South America, can deal with this crisis. Because prior to COVID-19, healthcare systems such as in Brazil, there were already strikes by healthcare workers asking for better working conditions and pay. Hospitals were being flooded when there was heavy rains, so the conditions weren't great. And there was also theft of medical supplies. We've also seen that in Venezuela, which hasn't yet reported a case. So I think if Venezuela starts seeing cases, that's of concern, because I don't think their healthcare system could deal with it. So I think that's a big concern would be, do they have the capacity to respond to this pandemic? And on a more individual side, I think in the United States, the individual cost. So if people have to stay at home from work and lose income, but still get the virus, and they don't have great health insurance, then they'd have to pay the cost of the health insurance and the tests itself and the treatment if they have to stay for a prolonged period of time in the hospital could lead people to bankruptcy, and it already does in the U.S. When it's not a pandemic time. So I think that's another significant concern would be to the individual impacts to people, and then the wider business impacts as well to businesses closing due to it.
Yeah, of course.
Why do you think Venezuela hasn't reported any cases? Is it a lack of testing, or is it a lack of movement across the border? And what impact do you think it'll have on a country that's already under significant stress like Venezuela is?
I'm not sure exactly why they have yet to report. It could be that over the last few years, there's been a net emigration, so people leaving Venezuela rather than in. So that could be a factor in terms of no one's bringing in the virus. It could be the government itself, the authoritarian government of Nicolas Maduro, not reporting a case having taken place. But ultimately, I don't particularly have a definite answer to that question. Mm-hmm. So it'd be interesting to see what happens in the next few days or few weeks, and if they do actually report a case. In terms of if they do report a case, I think that's what my biggest concern is that their healthcare system won't be able to sustain it, just because of the past few years with the economic, humanitarian, and political crisis in the country, and the continued embargoes and sanctions placed from the United States onto the country, it'd be interesting to see if they start reporting cases and does become so big, will sanctions be eased to allow for more medical relief to enter the country to help out? Because if it spirals out of country in Venezuela, that will have ramifications for the region itself, because we've already seen that just in terms of migration. Colombia's hosting, I think, over 2 million displaced people from Venezuela. Brazil hosts Ecuador, Peru. They all host a certain amount of Venezuelans in their countries. So if an outbreak does take place in Venezuela, and then there's even more emigration from that country into neighboring countries, the impact could be significant.
Yeah.
In comparison then, Viraj, what does Africa look like?
So the impact in Africa has so far been limited. So, nothing like we've seen in Europe, in Italy, in South Korea and China. So far we've seen, cases of discrimination or harassment in places like South Africa and Kenya. But nothing major. No hate crimes like we've seen elsewhere in Europe. Then there was a case in Kenya where a Chinese national was ordered to go into self-isolation, but when he had arrived at his accommodation, residents in that local area were sort of hesitant, and they wanted him to, go into self-isolation elsewhere. In Zanzibar, we've had authorities ban bar Italian tourists from entering. In Senegal, there was a recent case where 38 German tourists were barred from entering the Casamance region. But the sort of response that we've seen from African countries, again, hasn't been that aggressive. Hopefully now we'll see more aggressive measures being taken, especially since the World Health Organization declared this a pandemic yesterday. I think the challenges that African countries face, especially the likes of Somalia or Ethiopia, they have elections coming up. Even Malawi, where there's going to be a rerun of the election. I think we will see a rise in the political tension. Possibly this could lead to protests in opposition strongholds, in areas where they might just view this virus as being sort of a conspiracy theory. Given the global nature of the outbreak, I think that's unlikely, hopefully. But I think economies as well are heavily affected, so those that are reliant on tourism and oil as well. So I'm sure we'll see oil revenue decrease since the prices of oil have decreased as well. I'm sure we'll see more travel bans hopefully come in place in the coming weeks. I think NGO workers are highly at risk as well, since that many of them are French nationals, in West Africa, or even Italian nationals. So yeah, I think we could see potential attacks on healthcare workers like we saw in the DRC, and also possibly even we could see looting of pharmacies, thefts as well, and in some of these areas, where NGO workers they operate, many of them are suspicious of outsiders. Now, if an NGO worker was to, bring this virus in Beni, for example, in the DRC, we could see, an uptick in violence against NGO workers or healthcare workers.
I think that's an interesting part in terms of the actual changing of the profile of hate crime. So, the outbreak began in Asia, and then in Europe, where it next took hold, you had an increase in hate crimes targeting people of Asian appearance. Now it's kind of flaring up in Europe. You're seeing an increase in hate crimes around the world targeting people of European appearance. So the worry is that as the illness spreads around the world, you're just going to see a change in the profile of who's been targeted for as part of a hate crime based on where the actual illness is flaring up.
Thank you very much. Aaron, you're covering Asia for us. Do you want to give us an insight into that region?
So in Asia, there's like 3 major interesting trends. The first one is an explosion of cases in Iran. The second is an explosion of cases in South Korea. And then the third is a decrease in the number of active cases in China. So in Iran, when the outbreak started, they reported a very high death rate. So the information that came from Iran was already dubious, but when people saw this death rate being way higher than anywhere else in the world, it was sort of clear that either one of two things was happening, or they were not reporting their actual numbers, or they weren't aware of the actual numbers. Now we're about 2 weeks later, and Iran is heavily affected by the virus. Today they reported 1,000 new cases, so that's very heavy for any country. So we can kind of conclude that maybe the second part was true, maybe both, but they were definitely not aware of the amount of active cases, or they could not monitor them all. In South Korea, kind of the opposite has been happening. So there, the mortality rate was at some point really low, even to the point of 0.5%. And that's lower than anywhere else. And that's because South Korea was really quick to adopt widespread testing of its population. So yeah, first of all, people hadn't had the time to be sick for long enough to die, basically. And the second part was they tested so many people that the number of actual deaths was comparably low. So right now in South Korea, for every 1 million people, there's about a little bit less than 4,000 people are tested. Compare this to, for example, the US, there are only 5 people are tested out of every 1 million citizens. So when you were talking about Venezuela and their health systems not being prepared enough, I think we could say the same for many Western, like modern industrialized countries. Netherlands, Japan, they're all struggling to have the capacity to test enough people, and then that's one thing, but then you also have to isolate them or quarantine them. So
that appears to be the key, is that if you actually put in place testing measures, you can keep the mortality rate down as long as you have an advanced healthcare system. And I think you're absolutely right. I don't think many Western countries could actually mimic what South Korea has done. The worry is it's developing nations that can't put in place these testing measures, have a poor healthcare system, and they're just going to see far higher mortality rates.
Yeah. So in that case, I think South Korea is a very interesting case study. I've seen drive-through coronavirus tests. They have developed a test that only takes 10 minutes to conduct. So in that sense, an interesting country. The third trend that we're seeing is a decline in active cases in China. So China, the big hospitals that they were building that we saw everywhere, they've all closed down. So 15 of those makeshift hospitals have closed already. They've been sending supplies, medical supplies, and medical professionals to other countries, mostly Italy. And they have shown this. The propaganda machine has been really turning. 2 or 3 days ago, Xi Jinping visited Wuhan. So that's already a big deal that the leader is at ground zero, pretty much. And there he didn't so much declare a victory over the virus, but it was definitely, the message was, our centralized government with our decisive action has helped to curb the virus. And now it's up to the rest of the world to sort of imitate our example. And Italy has been doing that, for example, where big areas have been quarantined off. So they've been really pushing this narrative, let's say.
So leading on from Italy, we'll go and discuss Europe, Michael.
Yeah, so obviously Italy is the key country which has had the main outbreak within Europe so far, and they've gone from quarantining the northern parts of the country to then a full quarantine like 2 days later. They've also ordered a nationwide closure of all restaurants and bars, along with most stores. So what you're seeing is these large queues outside supermarkets, made even longer because the government mandates that you have to have a distance of 3 feet between you and another person. Now, Matteo Renzi, he has also warned that unless Europe goes into takes similar measures to what Italy's seen, then we're going to see a complete lockdown of Europe within the next 10 days. Denmark has become the second country to actually impose a lockdown against coronavirus, and Chancellor Angela Merkel, she stated on Wednesday of this week that the coronavirus was likely to affect 2/3 of the German population. So it's really starting to take hold within Europe and starting to spread.
So if we take a look at the kind of medical impacts of coronavirus across the globe, what are we seeing there?
So I think in terms of medical impacts and threats, I think it'll be a lack of supply. So I think in South America, as earlier speaking, there's certain healthcare systems that I'm unsure whether they could handle the crisis. So I think the lack of equipment, whether it's drugs or protective equipment for doctors, as we've seen like a mass shortage for healthcare workers in the world, I think that could be an impact. But in cases, there could also be fraud. And so in Ecuador, somebody posed as a doctor to knock on people's doors, saying that he was there to test them for coronavirus. And instead, he drugged and robbed them at the point. So there could be cases where people use the crisis as a means for crime. So that's one of the impacts I think I can see.
There was a similar incident in Trøndelag in Norway where somebody was pretending to be a doctor who was conducting medical examinations of people for coronavirus and then just using it as a cover to actually conduct burglaries. So, humans will find ways to make the most of a crisis to actually benefit themselves. So one thing that we obviously monitor very heavily is just the societal implications of the crisis and kind of how that's playing out. And one is people using the crisis as a way to actually fill their own pockets by conducting criminality.
Well, and I think we saw that early on with people selling stockpiles of masks or hand sanitizer via websites at prices that increased significantly. And I think places like eBay and Amazon tried their best to kind of combat that of people trying to sell those two supplies at gouging prices. So.
Google has now announced that they won't allow it for face masks anymore. Any adverts for face masks you won't see via Google anymore.
Okay.
And in Italy, you've seen trucks carrying medical supplies that have been targeted, probably by organised criminal groups who will then sell those medical supplies in the black market. You've also seen armed robberies of pharmacies, of people going after, again, medical equipment. The risk is that as the virus flares in certain countries, we see similar instances in those countries of people targeting pharmacies and hospitals and conducting thefts. I think the bigger or the biggest worry for nations is as the cases flare, there's a sudden spike of infections and it leads to the actual health service not being able to actually cope with this sudden spike. So if you have an infection outbreak and then you've got the peak infection point and then it kind of tails off, I think the point for all governments is to try and flatten that as much as possible and extend that period out, which is why we're seeing the mention of sort of containment at the moment. But there are certain countries who have gone and taken extreme measures, which is probably appropriate given the nature of the virus. But I think there's some nations which are failing to actually keep up and actually put in place measures that will contain the virus.
And I think you talked about, like the capacity of the system, whether they can handle the cases, but I think there's also reports of, say, in Italy, where the doctors themselves who are treating the patients are getting sick. And so I think there's decisions to be made. If your first line of response is getting sick and maybe can't work, or how do we, as the world, respond to that case? Because there's also other implication as well. Because if we all of a sudden start closing schools or taking measures, travel bans and things like that, to where healthcare workers who have kids now have to stay home and take care of their kids, who then takes their spot to help people at the hospitals, or who takes care of the kids while their parents are at the hospital. So I think there's a wide range of issues that can impact the medical sector in that regard.
Yeah, and like you mentioned, obviously, the impacts of the medical sector then lead into these societal issues. So you mentioned, the targeting of goods, carrying kind of pharmaceutical equipment and things like that. But what other societal impacts are we seeing? I know we briefly mentioned kind of hate crimes, but is there kind of more we can expand on that? Where do we see that going?
I mean, there's too many to mention. You know, we literally have lists of hate crimes of people targeting people of Asian appearance. You know, a surge in hate crimes in places in the UK, like Exeter. They reported a surge in hate crimes. You know, Chinese people being spat on in Europe, the targeting of Asian restaurants. Like, we could go on and on the quantity of incidents that we're recording within Intelligence Fusion. But I don't see that lessening. I see that getting worse. And as we mentioned earlier, the kind of shift in the profile for hate crimes is probably going to be around where the virus is actually flaring at that time. So, yeah. I mean, it's interesting, in the US, you've actually seen an increase in gun sales among Asian Americans off the back of this rise in hate crimes, which is an interesting aspect of it.
Yeah, so I think it's probably worth just following on there. So in addition to the kind of newly reported cases across the globe, we are actually monitoring these additional impacts, or the societal impacts, such as hate crimes and the kind of organised crime that's coming off the back of this, which is all kind of able to view within a theme that we've got within the platform. So there's a tool there that you can use to monitor kind of trends and patterns within the data. You can see it as a heat map as well. And all of these different kinds of incidents are actually included within that. So not only do you see the increasing rate of infections being reported, but you actually see the wider impact of this, giving you kind of additional context around coronavirus.
I mean, we even have, you know, a vigilante icon within Intelligence Fusion,
Yes,
and we're seeing vigilante groups that are kind of springing up off the back of coronavirus. So there's the Guardian Angels who've been patrolling in Chinatown in New York. So you can actually even dig down to the detail of, you know, where vigilante groups are rising off the back of the coronavirus infection.
I think from a society, you get the physical hate crimes. So like in New York City or Los Angeles, you've had people get physically assaulted for being Asian, whether in some cases because they were wearing a mask, in other cases because they weren't wearing a mask. So there's that regard. But then you also get kind of society as a whole kind of putting certain groups all in the same boat, basically. So people avoiding completely Chinatown in New York City or in San Francisco. And that impact has an economic impact on the businesses in those areas. So I think you have initial racism and initial hate crimes taking hold now that we see as singular incidents, but all that will have lasting impacts for those communities as businesses close, because there's no foot traffic within certain communities in the United States, at least.
I mean, within Europe, there's been some kind of really interesting developments. So in France, you've seen people pretending to be French government officials, walking up to people of Asian appearance with face masks and actually charging them €150 for wearing face masks. So again, kind of using coronavirus to conduct criminality. Within Italy, so where the government has actually restricted movement and visitors have not been able to go and visit their family members who are in prison, you've actually seen protests outside of prisons, but then also rioting within prisons across Italy. And it actually led in Foggia, where you actually, in the confusion and the chaos, 50 inmates managed to escape from prison, of which I think 20 were initially caught, but then you had 30 who were still on the loose, and you ended up having the Italian military being deployed to Foggia as part of this effort to actually round up these people, and they were warning shop owners to actually close their shops whilst this was going on.
So you've had kind of various, and we mentioned very briefly there, the economic impacts, and we've had various kind of measures put in place by governments. But what else are we seeing? What are our thoughts on the economic impact going forward?
I mean, the stock markets have taken a plunge off the back of this becoming a pandemic. And with this kind of lasting for 3 to 7 months, obviously we're seeing things like manufacturing locations closing down, supply chains have been significantly impacted by this. And, you know, when a supply chain closes down, it's a long process to kind of get that back up to where it was before, because the issue you've got is, as say the supply chain closes in China, you then have the virus moving to Europe and perhaps they're going to close down ports. So even though manufacturing may increase in China and they're ready to move goods out of China, you might have regions of the world where they're not going to accept these goods because they're on lockdown. Now this, the worry for me is that this actually becomes a global recession because of the economic impact. Obviously in 2008, we managed to get through that economic issue, but now we're in a position where the interest rates are so low, there isn't really the room to actually stimulate the economy if we do actually head into a global recession. So, the interest rate in Europe is 0%. In the UK, it was 0.75% until I think 2 days ago when they lowered it to 0.25%. But if you have a global pandemic, my assessment is that I can only see this going towards a global recession, which obviously then has further societal and business impacts off the back of it.
Yeah, and we've seen multiple countries do their best recently to try to avoid that, in terms of Australia recently passing a stimulus package, and then the U.S. Congress, I think, going to a vote on a stimulus package or a coronavirus, which includes a stimulus package, today. So it'd be interesting to see what happens in that regards, and whether, if the U.S. does pass a stimulus package, whether maybe it eases investors and maybe stabilizes the market. But I don't see it happening at the moment. I think we're still too early within the coronavirus pandemic, at least within the U.S. or within more developed countries like Europe, and to actually have anything that will stabilize the situation for now.
I mean, if you look at the actual short-term economic effects of a recession, it impacts business profits and capital investment. So you see a falling demand could cause more businesses to fail and profits to fall. And as which you're seeing things like banks are saying to certain small businesses that you can actually postpone loan payments as a measure to actually respond to that. But that can only last for a certain period. You will likely see an increase in employment, and there'll be an impact on government finances. It's going to have an impact on inflation. And those are just the short-term measures of a recession. But if you look at it being a global recession, it just kind of compounds these issues. So yeah, it's worrying from an economic perspective, especially. And for me, I kind of see you've got multiple aspects of this. So you've got the coronavirus, which is having an impact on the medical situation, which is then having an impact on society and business, which is having an impact on the economy. And as these certain elements of society start to fail and have stress points, they are then kind of impacting each other and making the situation worse. So yeah, my worry is that we're going to head towards a global recession off the back of this. So like, for me, the most likely course of action is that the pandemic spreads. We get to a point where 3 to 7 months down the line, and it's still having an impact, and it's giving us an economic impact. However, at that point, it starts to lessen, and the economies are able to respond. In the meantime, we've seen societal impacts on governments and elections off the back of the anger as a result of it. The most dangerous course of action is just compounded by events. So say, for example, the actual coronavirus outbreak quickens in certain countries, it overwhelms the health service of that country, and then has societal impact. So we see things like rioting, we see situations like the London riots in 2012, where people see a lack of police presence and just use that as an opportunity to actually then go out and conduct looting. So I think the difference between the most likely and most dangerous is the main factor is just how quick the infection takes hold, and whether or not that kind of overwhelms the nation's security and health services, as well as the economy of the nation.
Thank you. For us here at Intelligence Fusion, what we're actually doing is offering kind of temporary emergency access to our intelligence platform that people can actually pay for month on month, rather than committing to a full year's access. We understand that many businesses and organizations right now don't have the time to kind of identify and assess new software or solutions that may help, no matter how more better placed they are to actually help in this situation. But we also appreciate that now more than ever you need, amongst the vast misinformation that is about, that you need kind of accurate and reliable and timely intelligence in order to help mitigate the risks against your business and protect your people and assets as well. So this way, doing the kind of month-on-month access, you can purchase your first month online, you get 24/7 support, and you can cancel anytime as well. So I'll kind of leave the link within the comments so that anybody interested in that can either get in touch or sign up straight away online. And there's kind of various videos as well that we can send to you in order to ensure that you get the most out of the platform in trying to combat this pandemic. Does anyone else have any other insights to kind of round us off on? Well, Well, that's pretty much it for this week and our coronavirus special. We'll see you next week.